تفضل دكتور غسان، معك 15 دقيقة بالضبط.
وين هاي البوينتر وهي
ماشي. تمام. وهذا بدك تقلب بالسلايدات. تمام.
هي
بس ما بنقلب بهدول، بنقلب بهدول.
بهدول.
وهذا مؤشر بس.
تمام. اوكي.
لا تحت ولا فوق، هي اللي بتمشي لقدام.
هي لقدام.
هي مو شغاله، هي مشكلتها مؤشر مثل كثير ضعيف، فهي بتأشر فيها وهي مقلب بالسلايدات.
هي ما عم بيقلب.
بقلب بهذا.
بهذا. هيك. اوكي. مساء الخير. اول شيء بتحب اتشكر هي بحب اتشكر جميع الزملاء الرابطة السورية لجراحة العظام والفاصل، الزملاء جميع الضيوف الكرام، رؤساء الجلسة. ليش بدي احكي عن هلا انه ليه Salamehfix? We must look for history of external fixation, beginning of Stadler fixation, Ghassan, Guanesian, Cito, then the most popular Elizarov, with mostly wire fixation, can run across muscles, more painful, full ring, huge size, difficult to adapt hinges for axial correction. For all these reasons, Salamehfix external hinge fixation system found his way in the year 2000 between Damascus, Tartous, and Frankfurt, Germany. طبعا first impression realized by Mr. Wehr and her husband from Orthopedics company, Germany, during German Orthopedic Congress in Wiesbaden 2000s. Then presented my fixator on second Assami International Congress in Rome, Italy, 2001. And we can see here the German newspaper was published my Salamehfix fixator, and we can see here from Orthomed company, German company, Mr. Wehr and colleagues here, and the wife of Mr. Wehr. During fourth meeting, Assami International, Japan, 2006, we had creation discussion about Salamehfix system. Here we can see the international application, World Intellectual Property Organization, in all world countries published, and the WIPO Award Certificate for Salamehfix. You can see it was the first design of my Salamehfix for leg lengthening, correction of axial deviations, as we see here, alignment during lengthening and consolidation phase, and we can see alignment, perfect alignment during lengthening. Newspapers was published in Germany and Syria. فاز بجائزة الوايبو الذهبية في معرض الباسل الحكي قديم, and the newspaper in Germany was published here with my friend Dr. Michael Schmidt. He is here between us. It was a long time ago in Germany, published the news in Germany. Salamehfix external hinge fixation system differing with an external arcs various diameter and perimeter connected with the three hinged rods to act as a three-dimension correction hinge. Hinges are assembled at Cora and allows correction in multiplanar directions, oblique connected rods added to assemble extremity shape, so the fixator is small and fit the extremity, ease to wearing clothes above the external fixator, mainly used half pins enter the bone across special hinged holders, allows fixation bone fragments in various levels and angles, and it's making stable fixation on this way. Salamehfix 1 designed for extremity lengthening and correction. Then Salamehfix 2 was designed for foot deformity correction, Salamehfix number 3 for knee correction, and Salamehfix number 4 for femur deformity correction, and Salamehfix number 5 for metatarsal, metacarpal, and finger lengthening. Today I'll speak about Salamehfix number 1, but tomorrow my friend Dr. Schmidt will speak about Salamehfix number 2 and number 5. We can see his suitable design for cosmetic lab lengthening. Here we can see 13 centimeter with axial correction. We can see how suitable the fixator is applied on the leg, and we can see the smooth lengthening with simultaneous lengthening and correction of axial deviations. This is bone defect treatment. 23 years old man after fractures and repeated several surgeries. We can see here the problem on the femur, bone defect, many surgeries before, angulation, shortening. So what I did, the first stage was remodeling of the bone, cut the bone ends and align the bone and fixation with Salamehfix number 1, which I modified for femur treatment and lengthening. Then second stage was done for lengthening in the distal part of femur and bone transferring up. So we can see the alignment and lengthening around 9 centimeters. We can see how the femur is aligned and consolidation. Perfect alignment with 9 centimeter lengthening. We can see the alignment, consolidation, and perfect bone and the fixators. Consolidation and alignment for full weight bearing. Stability and mobility is very important. You can see the size, how it's suitable on the femur, the fixator is applied. 27 years old girl after severe trauma, bone defect, 8 centimeters. This girl came to us from Algiers many years ago, and what I did here, lengthening from distal tibia and transferring bone up to contact the upper part of tibia, compression, then compression at the bone at upper part of tibia, lengthening of distal part, and we can see amount of lengthening, it's around 8 centimeters. We can see consolidation and alignment, stability, full weight bearing of the system. We can see on the X-ray full consolidation and bone union. We can see the case before treatment, and here's after treatment. Very severe case. It's congenital pseudarthrosis. The girl 17 years old, فتاة في عمر الزهور, was done before many surgeries, failed surgeries. We can see how much the deformity is. So what I did, the start point combined lengthening, fixator Salamehfix number 1 with foot, fixator Salamehfix number 2. So I started to make lengthening from upper part of tibia, descending the bone down to attach the foot. And we can see the combined fixators of tibia and foot. Here we can see during lengthening in upper tibia and compression in distal part of tibia. During lengthening phase, we can see the difference from before and after. As we see here, on the scale, lengthening amount, 20 centimeters, lengthening on upper tibia, and compression, we can see compression on distal tibia to ankle foot. So she has no joint, of course, of ankle joint. So it was done compression of distal tibia to the foot. And we can see the situation before treatment. We can see the end results, and we can see consolidation, and we can see the length achieved of the leg with Salamehfix hinged destruction external fixation system. Another case, we can see the hand, club hand, congenital club hand management. The deformity before, the girl is 23 years old, a neglected case, came to me, and first stage I was applied the frame on the forearm, make centralization of the wrist, fusion of the wrist. And second stage was done is lengthening of ulnar bone with the correction of bowing of the ulnar bone. And we can see there the end results before and after. Conclusion, Salamehfix number 1 is a hinged 3-dimension external arc fixation system, correct or angular deformities, effective in bone lengthening and bone transfer, and it's comfortable to patients in size, stability, mobility, and weight bearing, and it's comfortable and effective for treatment of bone defects, lengthening, and deformity correction in upper and lower extremities. Complications were mainly just superficial pin infection, and it was treated locally. And would like to thank you all for attention. This is